I was so honored and delighted to be awarded this prize by the Library of Congress, because the Library of Congress is a place very dear to my heart. It's a place where I have done research since the very beginning of my career as a historian. And I find libraries and archives to be something rather magical. I always feel as if I get into a time machine and can really delve back into another era and another kind of understanding of the human condition. Library of Congress has had a number of very significant contributions to my work. One, perhaps of the best known of the kinds of materials I used, are the photographs, the Civil War photographs, which are such a rich resource. Now, many of the best known Civil War images in the library's collections are the ones of the bodies on the battlefields, the Gardner and Brady photographs. But in my book about death, I found a lot of images that I hadn't been familiar with before about other dimensions of death, embalmers on the battlefield, or grave diggers working together, or a whole other set of visual representations of things that I had been finding in words in my research. So that was a marvelous treasure that the Library of Congress unlocked for me. But a set of manuscripts also are one of my favorite elements of that book, manuscripts that are in the Library of Congress. And those are the papers of Clara Barton, the battlefield nurse who kept extensive records of her experiences during the war, and also was very involved in some of the issues about identifying the dead and honoring the dead that were at the core of my work in this Republic of Suffering. And I remember one of the most moving things in the collection for me was a set of little notebooks, very small, in which she would write down information that patients would tell her as she was serving them, with their addresses, next of kin. And knowing what I did about the high level of mortality and the lack of dog tags or other identification, I'm sure that she kept this information so that if an individual died, or if she wished to communicate for some other reason with the family, she was able to do that. And they were just the right size to keep in her pocket. So I could imagine her moving about the Civil War hospital with this little notebook, now in the Library of Congress, in her pocket, in her hands, as she undertook the work, not just of medical service and care for these individuals, but trying to care for their families, those around them, who might never otherwise know what the fate of their loved ones had been. So the very physicality of those books meant a great deal to me, and that's part of the Library of Congress's wonders.